Senator Murray.
Thank you very much, Mr. Chairman. Mr. Secretary, welcome. Good to see you here.
Thank you.
As you know and have told us yesterday, the VA announced that an agreement for the new EHR contract had been made with Oracle. And it's really important to see that VA is prioritizing reliability and responsiveness and patient safety across the contract, so I appreciate that. Now, just last week, GAO released a report indicating that the VA had not established target goals to assess user satisfaction, and that until it does, VA lacks a basis for determining when satisfaction has improved enough for the system to be deployed at any other sites. I support the reset period, as you know, and I support efforts to move forward, but only after, of course, that you are confident about the safety and effectiveness of the system.
Yes.
And have a clear, established satisfaction markers, and what matters is what the providers and veterans on the ground think. Our veterans, you and I both know, deserve the best health care we can offer, and it's our job to make sure that the VA and Oracle Cerner really get this right. I have a couple questions around this. When do you expect to have a revised request for the EHR account in fiscal year 24, as well as an estimate of whether you need the funds requested to support the rollout in the IT and medical facility accounts?
So first of all, I think I just want to make sure that we're absolutely clear that roughly a little bit over $400 million that was set aside for this year, we've communicated to you in the Appropriations Committee that we do not anticipate needing that money this year. So I want to be very clear about that, one. Two, on the updated request, both for the rest of this year and then into next, I think we need a little bit of time, but not much. So I don't have a specific timeline for you here, but we recognize that this 1 year option that we've just exercised is a great opportunity for us to test whether we can get those 5 sites working.
Right.
And not only that, but we have providers in each of those 5 sites that you've brought to our attention, and we have vets in each of those 5 sites who have big expectations and they're tired of waiting. So we're not asking for a lot of extra time, but we want to get this right rather than get it fast. So I think rather than give you a firm commitment, I can tell you that this is, number one issue for us at the department to come to the committee with a revised request.
Okay, and do you have plans to establish targets to assess user satisfaction?
User satisfaction is going to end up being, it is a critical part of this. Whether we have a specific target set, I'll get back to you on that. But one of the principal ways we're going to be able to figure out whether we're working in the 5 sites is going to be user satisfaction.
So that will be part of the evaluation?
Correct.
Okay.
Whether we have specific targets that are laid out on some timeline is what I'm not
Are there
aware
any
of.
changes that you've made and plan to make based on provider feedback at this point?
Well, a big part of it is the enhanced accountability measures around uptime and system reliability. That comes directly from the user experience.
Okay, thank you. Well, as you know, we're following this very closely, and
I've noticed.
really appreciate the VA's diligence on this, and want to keep working with you, so
Thank
thank
you.
you. Thank you.